OET and its new update by Cambridge Assessment CEO Sujata Straid.
At the forum today, the objective of the forum actually is to bring together the community of stakeholders who are interested in communication in healthcare. So the topics today were very much along the lines of actually not only focusing on the developments in OET and how OET is actually providing kind of support for nurses and doctors who want to go and work in in United Kingdom, but also more importantly, also why is communication so important in the healthcare context? And why is a test like OET so important, given that there are other English language tests which are, bigger and more well established, but they're more general or kind of more academic. But why actually communication, being able to communicate with your peers, being able to communicate with patients, being able to communicate with carer is so important. And generally, I think what the keynote speakers and other speakers have said is that why actually communication is so important in the healthcare sector is because there's a direct link between how well I'm being able to communicate with my patients or with my peers and the patient outcome. So the direct link between good patient outcome, quality and safe care, and good communication. And also many of the speakers have kind of shared kind of research which shows that poor communication can lead to kind of patient mortality. For example, some research was given from the US where they said that every third kind of error which led to patient mortality was due to poor communication, and also the financial impact of poor communication having on healthcare systems and hospitals which are already under financial stress. So that's the key theme. The key theme is all about how healthcare communication is our shared responsibility. And so we have a fantastic group of speakers at the forum today who are kind of specialists in healthcare communication. They're from the government. Then we have got also representatives from Health Education UK. So they're all talking about how actually OET and healthcare communication is important for them. So I perhaps won't be able to elaborate too much because that's one of the speakers had actually, one of the other speaker had presented that. But from my understanding, that was a research done by Joint Commission International in the USA. And Richard, do you know a bit more about it?
No, not the specific research. I think
Yeah.
the general theme is just how important communication is in a healthcare setting, because if you get communication wrong, it isn't just simply a misunderstanding. That misunderstanding can lead to really tragic consequences as well. So I think that's been a sort of underpinning theme for the forum, is how important communication is to healthcare all over the world. Regardless of where doctors and nurses are from or going, it's critical in every healthcare setting.
The main way is different actually is OET actually focuses on communication in the healthcare context. What OET actually assesses is the ability of healthcare professionals, doctors and nurses, how well are they able to communicate in a clinical healthcare context. So very much, yes, we do test, like similar to IELTS, it does test your pronunciation, your grammar, but in addition it also tests the requirements of communication in the healthcare context. To give you an example, as a doctor, you often have to kind of translate specialist language into everyday common language so that your patients can understand you. So we test, as a doctor, am I being able to translate specialist language to common language so my patients can understand me? Of course, we know in communication in healthcare, being able to show empathy is very important. How you break bad news is very important. Also to deal with difficult patients. So it's very much, communication in the healthcare context. What is actually important as a healthcare professional, as a doctor or nurse, when I'm talking to my fellow nurse or fellow doctor, or I'm talking to a patient, or I'm talking to the family of the patient, what is it in terms of communication that is important? It's not just speaking the right English which is important. It's actually being able to reach out. It's about being able to connect with your patient, to be able to connect with your fellow professional, being able to show the traits which are very important, what we call clinical communicative abilities, about empathy, breaking bad news. So what we'd call the finer nuances of communicating in a healthcare context. Do you want to add anything?
Well, and I suppose the key difference there is that with the IELTS test, it is a general test for academic purposes, so the context of many of the questions can be very random and spread over a whole variety of different topics, whereas ours are all healthcare centric.
Sir, I think it depends on why you're using the test. So candidates have a choice. Like, for example, if you're going to the UK and you want to be able to work as a nurse in the UK, you have to first register with the Nursing and Midwifery Council in the UK. So they give a choice to candidates of either doing IELTS or doing OET. So, if you're looking for a general test, you would do IELTS. But if you're looking for a test which is more specific to the healthcare sector, then you do OET. And typically the feedback that we get from nurses and doctors who are choosing OET, when we ask them why they're choosing OET, they say because of two reasons. One is they feel that preparing for OET actually is very helpful for them, because by preparing for the test, they actually pick up language skills they actually need to be a better doctor or nurse overseas. And secondly, they also say that once they've taken OET and they land up in UK or Australia, they feel like because they know what is the importance of communication in a healthcare context, they feel more confident in their workplace. So the choice is there, because most organizations give candidate a choice. So it's a candidate choice whether you want to do something more specific to your profession or you want to do something general. Yes, I think I won't be able to share numbers and all because I don't have that. But I think from our understanding, I think Kerala is one of the leading exporter of nurses overseas. So a large number of, and by the very fact that we have more nurses doing OET in Kerala than anywhere else in the world, perhaps demonstrates that perhaps, for Kerala nurses, UK is a very popular destination. And likewise, I think, that I think the UK actually relies on nurses from Kerala. Thank you very much.
OET and its new update by Cambridge Assessment CEO Sujata Strair.